on the uterus in the absence of a pregnancy. Then the uterus sheds. So menses can be defined as cyclic or regular, shedding of the inside of the uterus in the absence of pregnancy. Or some clever chap said it is the shedding of tears of the uterus for a lost opportunity to get pregnant. You understand?
I like that one.
So in short, this is what menses is. You have to know the normal menses. And here, they should listen very well. The normal menses is from 1 day to 7 days. So don't come to the doctor if your menstruation is only 1 day. It's normal. 1 or 2 days. It's normal. Okay? 7 days. Don't come to the doctor and say, no, I've got prolonged periods. It's very normal. So 1 day to 7 days is very normal. And then the distance between the menstrual periods must be between 21 days to 35, 37 days. So I think you have heard of women saying, is it normal to menstruate twice?
A lot.
Yes and no. Yeah. They forget that the cycle can be 3 weeks. So let us take, for example, if you menstruate on 3rd January and your cycle is 21 days, when are you going to menstruate? 24th January. It's normal. Yeah, there's no need of running to the hospital and say, no, I've got a menstrual problem because I'm menstruating twice in a month. It's just once, it's a single cycle. And then you can also miss some cycles because your days are, for example, 37. So the month will finish and then you go into the next month. It is also normal, okay? So that they should understand that it's between 3 weeks to 37 days. That is the normal menstruation. Now we can talk about the problems.
No, very enlightening, because already at the pharmacy we have so many women who come and say, I started and again I've started, I think I've got a problem, I need to see a doctor. So you've really explained it very well. Hope people have listened.
Yeah. Now what we do as in the hospital, we just chase you. go back. So there's no problem. Of course, you'll be disappointed. The woman will be disappointed. They wanted, a barrage of tablets and whatever. But we just say, no, mama, it's normal to have a bleeding so-called twice because your period is 3 weeks.
Wow,
Go back. Yeah, you shout at us a little bit, but we survive. Okay, so let's talk about the problems. The problems we are going to talk about quickly here is what women come with. They usually come with the complaints of, my menses are irregular. So irregular menstruation. Then they will come up with the complaint of saying, my menses are very heavy. They are going up to 10 days, they are prolonged, and they are very heavy with heavy clothes and all that. Menorrhea in science. Then they will come up and say, no, me, between periods, I bleed, which is called in science metrorrhagia. So in between periods, bleeding. We see some women complaining a lot about that. And then the biggest culprit is painful menstruation.
Very much.
Because 80% of women feel discomfort during menses. But the discomfort should not make you fail to cook or to sweep or to care for your husband or boyfriend or whatever. It should not disturb you to that extent. But unfortunately, we have women, when they are in menses, they cannot do anything. They will be rolling on the ground crying. I remember when I was a junior doctor, we used to have a young girl of 16 years who was coming every month. We knew the date was 26th. She would come crying. We had to use pethidine in order to control her pains. Yeah, so that dysmenorrhea, painful menses, is quite a headache to most women. But of course, some, they don't understand that there is no menstruation that will not make you have discomfort anyway.
Yeah, true.
There is, what we worry about is the levels of discomfort. Yeah, the levels of discomfort. Okay, so now let's start with one of the problems which I've mentioned. And the other one which the women will come with is absence of menstruation, amenorrhea. This one also poses some problems. Sometimes say, no, I'm not menstruating for 1 year, so 6 months I'm not having my menses. What could be wrong, doctor or pharmacist? So we start fumbling around looking for the problem. Now, irregular menstruation. Here the women must listen very carefully. Irregularity of a period is only a disease if you want to conceive. Because irregularity means this month you had 3 weeks. The next month you had 30 days. The next month you had 35 days. The next month 3 weeks. That is irregular. But it doesn't make you sick. But most women, they still come to us and say, my menstruation is irregular. I always ask, do you want to have a child? No, I'm done with children. So what's the problem if it's irregular? So, you understand? There's no problem. It doesn't kill anybody. No, an irregular menstruation does not kill anybody. Yeah, go in peace, lady. And of course, with anger, she goes. So, if you want to conceive, yes, come to us if you're having irregular periods, because then your hormones are basic, but they don't make you sick as such, but it makes it difficult to conceive. No wanting a baby, there's no need of correcting irregular menstruation. Live with it, it corrects itself with on irregular menstruation. The next one is the menorrhagia, heavy, prolonged periods. Some women go up to 2 weeks even. They are just bleeding. They even become anemic.
Yeah.
They have little blood, which is very unfortunate sometimes. The most frequent cause for this problem, checked for fibroids. That is the major contributing factor in menorrhagia, prolonged masses, the benign masses, non-cancerous. They just grow there from the muscle of the uterus, but they make the uterus every month not to contract when you are having menstruation. As a result, you have very bad increased levels of bleeding. So you check for fibroids. If you don't find the fibroids, or we don't find fibroids on you, then we shall do a hormonal profile to check if it is a hormonal imbalance problem. It happens. Majority of cases is fibroid, but some cases are there which have to do with the hormonal imbalance. For some reason, maybe due to stress, worries, in Congole, husband out, go crazy. Yeah, the periods get affected. So when you come to us, we try to prod it. Do you have a funeral? Do you have in Congole which you haven't paid? Is your husband staying at home, or he comes at 4 hours? All that kind of stuff. That can actually disturb you. Are you on any injectable preventive medication, contraceptives, Depo-Provera, Jadeva, and all that? We try to find out that. How do you treat it? Obviously, if you have got fibroid, there is no treatment. I've heard some women saying, I'll go to town, there's a herbal clinic where you take something and it dissolves the fibroids. Zero, don't even try that. Those herbalists are actually, yeah.
And many women are doing that.
Something.
And many women are doing that in Lusaka. Like, I think if they've got any problem direct in town, those are posters we see, and they'll grab them and they'll go to get traditional medication, herbal medication.
You know where they go? They go to these herbal clinics with a computer, with a probe which they hold in their hand, and it tells them all the rubbish they can want to hear. And then they are given a bill of 2,000. So,
and they will pay.
Yeah, so that is a big problem. They will tell them, no, this is calcium is a problem. That's why your periods, phosphorus is a problem, and all those kind of things. So they should desist from that. Nothing can dissolve the fibroids. Fibroids, if they are small, we just leave them and observe you every 6 months. If they are big, you have to have surgery. We remove the fibroid. Or if it is a messed up womb, we remove the whole womb to save you, because bleeding can kill you.
Yeah.
You choose between a womb and death. Yeah, so most people choose life. Yeah, So that's menorrhagia. And if it's due to hormones, of course, we shall give you the missing hormones. If it's estrogen, we add estrogens, we add progesterones, and the bleeding stops. And that's why most of the women have heard sometimes we give them microgynon. It's because those are hormones we try to elevate their levels of hormones. And most of them, they benefit. The bleeding stops because we have elevated the lower levels of hormones. That's one. Now, metrorrhagia, the bleeding between menses. That is, your menses maybe 1 month, but 1 week you're bleeding, another 2 weeks you're bleeding, 3 weeks you're bleeding, just chaotic. Most of the causes here is not fibroid, because fibroid will just start and it doesn't stop until we try to do something about it. The problems here are, one, injectable contraceptives, Depo-Provera, Jadel. They make you have on and off bleeding between periods. The other problem here could be, as I was saying, stress issues and worries, okay? The menstruation, I said, it starts from the head. So you mess up the head, it messes you up.
Everything
downstairs. Yeah, everything starts from the head. Most women don't know that. And the other reason is that you may have some polyps, small growths on the cervix. So when maybe during sexual intercourse, the pressure can make you bleed. The other one is CA cervix, carcinoma, cancer of the cervix, which you get contact bleeding. When you are washing, you notice some bleeding between periods. After sexual encounters, you see some bleeding. The other reason could be chronic cervicitis, that is inflammation of the cervix. It is red, okay? It could have some erosions, okay? A tear in the membrane covering the cervix. So that can also give you slight bleedings. So what is the approach? We simply treat the cause. If it's erosion, we bend the erosion with cautery, electricity, and antibiotics, face an infection. If it's a polyp, we cut it off, like a growth, we just cut it off, if it's a CA cervix, we are suspecting, we do a pap smear and the other investigations with acetic acid. And if it's not very advanced, we treat you there and then in the consulting. You don't go to the hospital if it's not advanced. There are some signs which you can see that. So that is the approach in bleedings that come without program. On, off, on, off. If it's due to Depo-Provera, we simply assure you this month, it will still be acting because that's why it is called Depo. It's a long acting, it will still be releasing small amounts, yes. And so we assure the person that with time, the body will get rid of it and the bleedings will stop. That is the bleeding between the menses. Further, we talked about that dreadful, painful menstruation, dysmenorrhea. The cause for dysmenorrhea is not well known, okay? There could be some secondary causes like fibroids, things like that, some tumors, cysts, big cysts and all that. But primary dysmenorrhea, which is what most women suffer from, you cannot identify the cause. Okay, you can't identify the cause. Sometimes we used to think maybe there is a spasm, we give you Buscopan and all that, nothing works. So you can't identify the problem. We have tried all Buscopans, scopolamine, and all these things and all that. Brufens, nah. So these painful menstruations are caused by a chemical that is released in the uterine muscles, which we call prostaglandins. So when we want to treat you, we shall give you not Panadol. Panadol does not work for painful periods. We shall give you something that is anti-prostaglandin. Aspirin, Indosit, things like that. And mefenamic acid. Mefenamic acid is very, very powerful for dysmenorrhea. All these are anti-prostaglandins. They neutralize the chemical that causes painful, painful feelings in the uterus, the prostaglandins. Aspirin, number one. Well, mefenamic acid is number 1, aspirin number 2, followed by Indocid and Brufen. You just choose what works for you. Some people, mefenamic acid works, some people it doesn't work.
They
So
don't
you
respond.
try all this, until you get what works for you. So you try to keep 4 days of supply. I'm sure the pharmacists don't like that. If they come every month and get costs for
That's money.
be honest. So she'll keep 4 days supply, 5 days supply of the said medicine every month. And it just takes it when she's in menstruation. Because there is no cure for dysmenorrhea. We can only control it. We can only control it. That's what we do about the dysmenorrhea. To tell the truth, we have tried cleaning the uterus, maybe thinking that it is in spasm. We have tried to give Buscopan, maybe thinking that it is due to spasm, but every gynecologist knows that at the end of the day, it doesn't achieve anything. The best is to give antiprostaglandin. The chemical is a prostaglandin, fight it. That's about dysmenorrhea. Now, we come to amenorrhea, absence of periods. My old professor who was teaching me once told me that whenever a woman walks into your consulting room, she's pregnant until proven otherwise. He said, even 67-year-old. So if your grandmother comes for consultation, just assume that if she has missed periods, she's pregnant. So he said every woman is pregnant until proven otherwise. And that teaching has held with me and saved me sometimes, because I have heard a lot of stories. No, I am not pregnant, but I missed my period. You check, you find a 5-month pregnancy. So you don't listen to stories. You have to assume that everybody is pregnant, including your grandmother. Before you rule out other causes. So, true story.
True story indeed.
We have seen this thing. So the number 1 cause of absence of period is pregnancy. So that's why I'm saying every woman is pregnant until proven otherwise. It's pregnancy. Until we rule out pregnancy, we can't talk. Then we come to think, okay, how old are you? No, I'm 45. So how long have you been having no menses? No, it's already 1 year. Then you say, oh, mama, that is menopause. And menopause is the absence of menstruation for 1 year continuously. Not 2 weeks, 3 weeks, like most women come complaining. 1 year. You have to have 1 year without menstruation. Some of them, they get early menopause. I've seen some women at 39, 40 years coming, no, I want a child, but I don't have periods. You check them, actually, there is amenorrhea. There are signs of atrophy of the genital tract and blah, blah, blah. BP going up, weight going up, sweating every night, shouting at the children and the husband, that cause not menopause. You wouldn't even know what you have done. So, just shouting anyhow. So
you just reach home and someone is upset and they are busy shouting at you.
Where were you? But you are coming from where? So you have arrived 30 minutes later in Lusaka with traffic at where were you? That's menopause for you. These jobs also you are doing, you don't even want to come home, but 30 minutes after knocking off.
And there was
that's menopause for you. So no, there's no traffic with a lady. First she will sort you out. There's no traffic. Doesn't exist. So we check that. Then we check if you are having Depo-Provera or Jadeo. These injectables, they create amenorrhea. So if it is due to them, we simply assure you that your periods will come, doesn't affect fertility. It will come, it can even take 7 months, but it will come and your fertility will be established. Then we look at issues to do with stress, like I said, the head, mood changes, stress, worries. If we pick up such and you are having absence of menses, then we know that the problem here is to do with the head. So we work on your head by counsel, not tablets. First, we counsel you, assure you that you are not menopause, you are just stressed. Don't worry about your husband coming at 4 a.m., making wish him at 4 a.m. Right. So yeah, stress is a major cause. Of course, things like TB of the uterus, womb. TB can be anywhere, skin, nose, everywhere there can be TB, not only the lungs, brain, and all that. Spinal cord. So TB, we check if you have got any TB, if you're having no menses, infection, chronic infections. Any chronic infection like advanced HIV, serious COVID disease can actually create amenorrhea, absence of menses. So any chronic disease, whether it is urinary tract infection, if it takes a long time, can put down your immunity, can put down the factors that produce hormones for the regulation of menstruation. So all these things are checked. So if we have to talk about treatment, we simply treat the cause. And women here must understand these things we see in the newspapers where, no, we can find lost lovers. I don't know where lovers go.
For them to be
We can
lost.
find lost lovers. We can treat your fibroids. We can treat your cyst, ovarian cyst, where we are going. And women just rush there. They lose their money. The ovarian cyst will still be there. The period will still not have come because the fellow you are going to doesn't even know if you have got 2 fallopian tubes or guesswork. They guess on you, the herbalists, the traditional herbalists. It's not that herbs don't work, but what we don't like is assuming that you know when you don't know.
True.
Because before you give any medication, you must know the dosage,
True.
where it is going, how it is coming out. This is the specialty of you pharmacists.
And
We
what
just scratch a little bit.
yes, and what will be the side effects?
I
I
think you
think this is
understand that.
if you ask majority of them, you ask them what are the common side effects. They don't know, and you'll be told there's no side effect, but there's no medication. Even water's got side effects. If you drink too much
water, can kill you. 10 liters of water, you are dead.
Yes.
Panadol, if I give you 10 tablets at once,
you're dead.
kidney failure.
But they'll tell you there's no side effect.
So Panadol can kill you if you overdo it.
True.
Yeah. So this is why we are encouraging our women. Go to your pharmacist, explain the problem, they might help you. Go to your doctor, go to people who have done physiology, who have done science. Don't risk your health over unexplained things. So that is amenorrhea, absence of menstruation. Yeah. Now, unless if you have got some questions, I think I have kept it short so that our people who are not very adept scientifically, they can understand.
Yeah.
We have simplified everything to the level of the common man and common woman.
The question that we had was with injections. There was a lady who had asked, she's been on Depo. She had gotten the Depo for 2 years. Then a year later, they decided they wanted to have a child. Then now there was a problem of bleeding. What can she do? Because now she's been bleeding throughout.
Okay. For me, my approach, usually what I would do, if she has got a child before, if she's not a prime gravid, I mean a primee, if that means no child before. But if somebody has had a child, that means has secondary infertility, and she's bleeding, I would try and clean the uterus.
Okay.
With manual vacuum aspiration, the modern ones. We don't use curettes, metallic curettes anymore. Just clean the uterus. Usually the bleeding stops because what you do is you renew the inside of the uterus, the endometrium, and it starts regenerating anew. Okay, so usually that stops bleeding. As for the effect of Depo, it's just a wait and see game. It's just assurance that one day it will get out of the blood system and fertility will come. That's how I would approach that issue.
Okay, I think, and this has been, for me as a pharmacist, I think we have been seeing, especially those who are working in private pharmacies, I think this has been a problem lately. In fact, last year, majority of the women would come, and now this is where now people will be put on northeristone for the rest of the year, over and over. I think with what you've explained, this is the correct approach, and I hope our women have heard it. I hope they've learned something.
You must understand, I have done 34 years looking after women. So we have developed some tricks, market tricks in the business. So we are very unconventional.
True.
So, yeah.
There was a question from a woman. She is 49 years old and she has stopped bleeding. Her question was, one, stopped bleeding, and the other one was now bleeding. Yeah. What can she do? I think these were the questions for the first time. These were the questions we're receiving.
Yeah.
Ask the doctor, what can I do? I'm 49 and I've been bleeding throughout, and my HB is dropping, has dropped from 13 to 8 to 7, in fact, now. What would be the best approach that she can do?
Okay. That is iron deficient anemia. Iron is being lost through bleeding. So first thing is you put in iron tablets with vitamin C to help absorption. HB7, 8 will still go up. It's not an issue as long as you deal with the bleeding. So first of all, you give those hematemics, which you pharmacists know very well.
Yeah.
So many sucrose and all that. So you give that. If she's not bleeding and she's 49 and the menstruation have disappeared, it is most probably menopause. If she has started irregular menstruation, it is still menopause. The uterus starts misbehaving, rioting. It wants to continue behaving like a normal uterus, but the time is up. So the hormones are chaotic, and it leads to on and off. Depending on how long somebody has had that, that's when we start giving estrogen therapies, okay, to calm down the woman, to put down in her some levels of hormones to try and help her. No ethesterone, which you guys give. That's the time when you can give that kind of thing. But most probably for both, it's already approaching that anyhow. And the one who has got absent menstruation, that one is totally menopause. Okay. Yeah. So it's a matter of counseling, and we accept the situation that we can't change. We can't fight nature.
We can't fight nature, true. There's a behavior.
Fight nature.
There's a behavior that we've seen in majority of the women, like you've mentioned. They would want to come to the pharmacy, or they would want to come to Dr. Teddy after the problem has now reached an advanced stage. What would be your encouragement? Like you've said, they'll see a poster in town, and that is the first. I think they'll even spend now thousands of money. When they see that the problem is not being sorted, that is when now they want to come to you. What would be your encouragement to them?
You have the pharmacists. If you don't want to go and see the doctor, the pharmacist will guide you, because they are aware of the extent of some of these problems. They will guide you. Either they can give you something to calm you down, or they'll say, no, go and see a doctor. Why? Because they are trained. Then try to avoid guessers, the quacks, as I call them. The people who promise you heaven and earth. I have seen people telling them to buy things that will dissolve fibroids, but I've been working for 34 years. I've never seen a fibroid being dissolved. So, but they never listen. They go and know these fibroids. They grow 6 months, it's growing. I have had people who went to TB Joshua. They never listened to what we told them after scan. That no, I'm going to TB Joshua is going to pray over me. The fibroid cannot be prayed out. Who died of anemia. The fibroids grew until it killed her. She came back. So she was living fearing to come to my clinic because I had explained to her that you cannot go and pray fibroids away. This thing is messed your uterus. Where is it going to go? It can't go anywhere. She was still refusing to come to the clinic, feeling shy, started bleeding, killed. She died. So this is a terrible thing for our women. Only if they can listen. Only they can listen. Others are told ovarian cysts.
It will shrink.
You know, that is also operative treatment. It can be dissolved by herbs and go to this one who is in Chawama. Somehow all these people are clever, they stay in compounds. They would be missing. Or Kalingalinga in one bedroom house. Wow. And he says he's an expert. So, yeah, you never find them in Kabulonga or there is somebody very clever in Kalingalinga. You die.
Dr. Teddy. And then maybe your comment on menstrual disorders and infertility. What should one do?
Infertility. The menstrual disorders that cause infertility is the absence of periods in the absence of menopause. Of course, you are going to go ovary syndrome, Stern-Leventhal syndrome, that is multiple cysts in the ovaries. So hormonal disturbance that disturbs infertility. So ovarian cysts, polycystic testes leading to infertility. So that is hormonal problems. Amenorrhea, not due to menopause. But things like dyspareunia or dysmenorrhea, painful periods, cannot make you infertile. Okay, although some women, they become so very painful. It has nothing, no role to play in having a child. Menorrhagia, of course, it's messy to engage in any sexual activity when you are having prolonged menstruation. So it's a matter. So that's how we approach these issues.
Okay. No, Dr. Teddy.
Cervical cancer, it's either we treat it. Yes.
Okay. Thank you very much. I think this is the first time I've had a live show, an educative live show, and I've laughed throughout. It was very educative, very uplifting. If it was change, very uplifting. We've enjoyed. For the people that have watched.
And funny.
And funny.
And funny.
We encourage you. There's a page called Docs Foul on Facebook. Please search for it. I like it. Follow the many discussions that are there. You can also like the Message Zambia. Tonight we had Dr. Teddy Andrew Mulenga. We were talking about common menstrual disorders, and we've learned a lot. Thank you very much for joining. Till Dr. Teddy Mulenga again will come. We'll definitely find I was watching his YouTube page and there was manhood problem. So definitely we are going to call him for that because I know he's funny and
you men, you have a problem.
Yes, we're calling you for that.
You want to look after yourselves.
Even us
okay,
men
no
go
problem.
to
Erectile dysfunction.
Yes, even us men go to Kalingalinga and Chawama also.
I know. No, you go for those boosters from town center where they say
Yes.
all funniest things. At Peruka Mwana or what Kawa and all that kind of stuff. The next moment you have a cardiac arrest.
Imagine, and so unfortunate, eh? So
Yeah,
thank you very much, Dr. Tate. We really enjoyed. We are going to
yeah.
call you again as MedSearch Zambia. With what we've discussed, MedSearch Zambia is a mobile
Thanks a lot.
medical application that we've created that is helping you women be able to find the nearest health facility where you're able to go to and get
A
information,
genuine one.
right
A genuine
information,
one. You should emphasize. A
genuine
genuine one.
genuine information.
Yeah.
Download the application. You'll find health facilities which are regulated by HPCZ, and you'll find health personnel who are qualified, who are able to advise you. This has been your MedSearch Zambia Friday Health Edition. Till next time, have a good evening.
Thank you so much.
Thank you, Doctor.
Bye bye.